It's been confirmed that 5 Australians are among the 41 new cases of the novel coronavirus on board a cruise ship docked at Yokohama in Japan. The new infections bring the number of confirmed cases on board to 61. Thousands of passengers are spending the next fortnight confined to their cabins to prevent the virus spreading. North Asia correspondent Jake Sturmer joins us now from Yokohama. Hi again, Jake. So there's been this spike in cases. 5 of them are Australian. You've been in touch with a few Australians on board that ship behind you. Is anyone you know involved?
Not at this stage, Ros. We understand the Australians we've been speaking to have not been tested, but I can confirm to you that those 5 Australians are not considered to be in a serious condition. They are among those 41 new cases that were confirmed today. That is a significant increase in the 20 that we had seen in the previous few days. And they will be taken out from the middle of the boat down there throughout the day. Those 41 cases, it is a very painstaking process. It takes hours as the passengers are carried out one by one, and they'll be taken to hospitals in 5 different prefectures right around Japan, in Kanagawa, Shizuoka, Chiba, Tokyo and Saitama. They are significant distances, so the passengers will have to be taken those significant distances on their way to specialist infection wards in the hospitals, because the authorities here were worried about running out of beds in this local government area. They had about 72 beds free this morning at the start of the day before these 41 new cases. So just to manage the risk, they are spreading it out across several different hospitals across Japan.
Do we know what the process is then, Jake? Are passengers tested who say that they are feeling unwell, or is everybody being tested?
Yeah, so Ros, one note of caution on this. We were waiting for the results of 171 tests. We had received the first 100 results, and that's where we got the 20 confirmed cases. Yeah. This morning we got the results of the 170 extra cases. Now, they were all either people who had symptoms like fever or cough, or were in close contact with those people. So it's not a surprise that we've seen this significant spike. However, cruise ship organisers have been distributing thermometers so that passengers can self-report if they get a temperature above 37.5 degrees. That has caused a little bit of concern among the passengers I've been speaking to, dread in some cases, but whether or not there will be more tests remains to be seen, and it'll be whether or not people develop symptoms.
So these extra cases, does this mean that the quarantine measures on board that ship, people being confined to their cabins, that they're not working, or is it likely that the passengers, the infected passengers, picked up that virus before the measures were put into place?
Yeah, I don't think you can draw that conclusion at this stage, Ros, given that these are the results from those tests that had been done before. What will be the indicator of whether or not this is spreading on board the ship is any future tests and any significant spikes in the days to come. That will be an indicator of whether or not the coronavirus is spreading throughout the ship. Passengers have been confined to their cabins, but some over the last 18 hours or so have been allowed out in very strict, very regulated ways. They have to wear masks. Only certain decks can go out for an hour and a half at a time, and they have to stay at least 1 metre away from any other passengers. Whether or not that will continue and more groups will continue to be let out, we're not sure at this stage. The captain did put out an announcement saying he hadn't confirmed those 41 cases that had been reported by Japan's health ministry. So an interesting disconnect between Japan's health ministry clearly not reporting directly to the captain if he's finding out, and passengers are finding out from the media.
And how are they feeling, those passengers? You've been in touch with a few, you said.
Yeah, having spoken to them, look, there's not a lot that they can do. They have to wait this out. They have to wait out the 14 days of quarantine. They're not overly alarmed, the ones that I have spoken to, given that these cases are from those extra 170 tests of which we had been waiting the results of. Whether or not that calmness and ease continues if there are more cases and as the cabin fever starts to set in, that's unclear at this stage.
Jake, thank you.